Today's topic is National AIDS Control Program. It comes under the control of National AIDS Control Organization, and this program is divided into four levels. National AIDS Control Program 1, 2, 3 and 4. One is started in 1992, second one is 1999 and third one is 2007 and fourth one is 2014. And the latest plan is National Strategic Plan for HIV and AIDS 2017 to 2024. The main targets include 000, that is zero deaths due to HIV, zero incidents and zero discrimination. And the second target is 90. 90% of them should be diagnosed. Out of them, 90% of them should be started on antiretroviral treatment, and out of them, 90% should have viral suppression. Coming to the surveillances, there are two types of surveillances. There are sentinel surveillance and HIV zero surveillance. Coming to the sentinel surveillance, it determines the levels of HIV infection among the general population, and it also understands the geographical spread of HIV infection, provides information for prioritization of program resources, and also estimates HIV prevalence and HIV burden in the country. Coming to the zero surveillance, it is done among high risk population like infectious disease clinics, ANC females, and high risk females like blood donors, commercial sex workers, IV drug abusers. And this zero surveillance is done every 2 yearly for 3 months. Counseling and HIV testing services. These includes integrated counseling and testing centers, prevention of parent to child transmission. Third one is HIV and TB collaborative activities. Coming to the integrated counseling and testing centers, these are of two types like fixed and mobile. And in fixed, it is of again two types, that is standalone and facility based. Standalone is mainly located in medical colleges, district hospitals and CHs. They provide HIV counseling and testing services. Coming to the facility based centers, these are located at block level like PHCs. They provide HIV counseling and testing services. Apart from this, they also provide public private partnership like providing rapid HIV testing kits, and they train the staff, and they also provide prophylactic drugs to the staff and protective kits. Coming to the mobile temporary clinic, it is hard to reach the areas, and counseling and testing services. They also provide management to sexually transmitted infections and regular health checkups, and they also provide immunization. Prevention of parent to child transmission. The main aim is to offer HIV testing to every pregnant woman in the country and estimates the transmission of HIV from mother to child. Initially, single dose nevirapine was given. Now, the Department of AIDS Control Program has decided to initiate lifelong ART to all the pregnant and breastfeeding females living with HIV, regardless of their CHD count, both for their own life and also to prevent vertical HIV transmission. It offers routine HIV counseling and testing to all the pregnant women enrolled into ANC, and promotion of institutional deliveries of all the HIV infected pregnant women, and provision and counseling and support for initiation of exclusive breastfeeding within an hour of delivery and continue for 6 months. Provision of ARV prophylaxis to infants from birth to minimum of 6 months. Follow-up of HIV infected child into routine healthcare services including immunization. Categories of districts based on their high risk population, they are divided into ABCD. If ANC is greater than 1% and there are no high risk groups and no hotspot, then it is category A. If the ANC is less than 1% and high groups are greater than 5%, it is B. If ANC is less than 1% and high groups are less than 5% with hotspots, then it is C. If ANC is less than 1%, high groups are less than 1% with no hotspots, then it is D. A and B category districts are high risk districts, C are moderate risk, and D is low risk. The Suraksha Clinic, they provide protection from sexually transmitted infections. They provide treatment using syndromic kits, help in zero surveillance of STI cases to know the burden of HIV in the curtain, helps in zero surveillance of STD cases to know the burden of HIV in the country. Coming to the Sunrise scheme, launched in northeastern states for the reduction of high risk groups. They promote safe sexual practices and promote blood transfusions. Coming to Nirantar scheme, it is launched in states with high prevalence of HIV like AP, Maharashtra and Karnataka. They enhance diagnosis of HIV and promote ART at local level. Link worker scheme, it is a community based strategy. It links district and sub district level services with communities. They also link high risk groups with vulnerable population also. Education, blood transfusion services ensure safe collection, processing, storing and distribution of blood and blood related products. Mandatory screening services for HIV, hepatitis B, C, malaria and syphilis, and to restrain from the IV drug abuse. Red Ribbon Club, it encourages peer-to-peer messaging of HIV prevention and seeks clarity of their doubts and myths. Mass education and health awareness and condom promotion safe for the safe sexual practices. Female condoms are given free of cost to the commercial sex workers. Male condoms provide to homosexuals, and free syringe distribution to prevent sharing of the needles. A National Strategic Action Plan for HIV, that is 2017 to 2024, for the reduction of 80% of new infection. 95% of them estimated should be diagnosed. Out of them, 95% of them should be started on antiretroviral treatment, and also for the elimination of mother to child transmission, and eliminates HIV AIDS related stigma and discrimination.